Title: Understanding herniated discs, Causes, Symptoms, and Treatments. Chapter 1: Introduction to herniated discs. Definition of herniated disc. A herniated disc is a medical term used to describe a condition in which the inner part of a disc in the spine protrudes beyond its normal limits. Discs are cushions that are located between the vertebrae in the spinal cord and serve as shock absorbers when moving and bending the body. When a disc bulges beyond its limits, it's called a herniated disc or bulging disc. This bump can put pressure on the nerve roots that pass through the spine, which can cause pain, numbness, tingling, and weakness in the area the nerve passes through. A herniated disc can be caused by a variety of factors, including aging, injury, being overweight, poor posture, and genetic predispositions. People who are exposed to repetitive movements that involve bending and twisting of the body, such as heavy physical work or some sports, are also more prone to developing a herniated disc. Diagnosing a herniated disc involves a physical exam, neurological exam, and imaging tests such as X-rays, CT scans, or MRIs. Treatment usually begins with conservative methods such as physical therapy, pain and inflammation medications, stretching and muscle strengthening exercises, and lifestyle changes. In more severe cases, surgery may be needed to remove the part of the disc that is pressing on the nerves and causing symptoms. However, most people who have a herniated disc manage to control their symptoms with conservative methods and do not require surgery. Anatomy of the spine and intervertebral discs. The spine or vertebral column is part of the bony system that extends from the base of the skull to the base of the sacrum. It consists of 33 to 34 vertebrae that are interconnected by cartilaginous discs, ligaments, and muscles. The vertebrae can be divided into 5 parts: 7 cervical vertebrae in the neck, 12 thoracic vertebrae in the upper back, 5 lumbar vertebrae in the lower back, 5 sacral vertebrae that are fused into a single bone known as the sacrum, and the posterior coccygeal vertebra. Vertebrae are interconnected by intervertebral discs. These discs are cartilaginous cushions that are located between the vertebrae and act as shock absorbers when the body moves. They consist of a fibrous ring and a central pulp core. The fibrous ring serves as an external protection, while the central nucleus pulposus acts as an internal cushion. Spinal ligaments are tough bands of connective tissue that connect the vertebrae to each other and prevent excessive movement. There are 3 types of spinal ligaments: supraspinal, interspinal, and ligamentum flavum. Back muscles play an important role in supporting the spine and enabling trunk movements. The main muscles that act on the spine are the muscles that are located along the spinal column and the muscles that connect the spine to the shoulders and hips. The anatomy of the spine and intervertebral discs is important to understanding the causes of spinal problems, including back pain and other symptoms. Understanding the anatomy of the spine is also important for making a diagnosis and choosing the most effective treatment. When the inner part of the vertebral plate protrudes through the ecological fiber and pressure on the nerve root or spinal cord, this condition can cause illness, numbness, weakness, and other symptoms, which can affect the patient's quality of life. The incidence of herniated discs varies with age, sex, physical activity, and other risk factors. It is generally true that this problem often occurs in older people, sports people, and people with a sedentary lifestyle. According to some estimates, a herniated disc occurs in approximately 1 to 3% of adults, but can reach up to 10% in people over the age of 40. Men are slightly more likely to develop a herniated disc than women. In addition to age and gender, other risk factors for disc herniation include excessive physical activity, movement of heavy loads, poor endurance, repetitive movements in a sedentary lifestyle. Also, genetic factors can differ in disc herniation. Treatment of disc herniation usually begins with conservative methods such as physical therapy, anti-inflammatory drugs, and injections. In some cases, surgery may be required as conservative treatment and improvement of the patient's condition. Overall, disc herniation is a common problem that can affect people's daily lives. Preventive measures such as physical activity and proper posture can reduce the long-term maintenance of the discussion, and with convenient treatment, a better outcome can be achieved and the possibility of permanent consequences can be reduced. Chapter 2: Causes of disc herniation. Overloading the spine. Overloading the spine is a common phenomenon that occurs when the back is placed under too much stress or strain. This stress can arise from various factors, such as lifting heavy loads, repetitive movements, sedentary lifestyle, poor posture, and sports activities. If overload is not treated properly, it can cause back pain, sadness, muscle tension, and other unpleasant symptoms. Excessive lifting of heavy loads is one of the most common causes of spine overload. Lifting heavy loads can cause strain on the spinal muscles and spindle, which can lead to back pain. It is important that we use proper engine technique when lifting heavy loads and not start a larger load, such as more repetitive motions can also factor in back strain. That it can happen during work, where we have to constantly bend the spine, but also push it into an incorrect position. It is important to use proper posture during these activities, and to maintain a balance between the activities in the beginning. Sedentary lifestyle is another factor that can affect the overload of the spine. Sitting position can cause bad posture and affects the spine. It is recommended that we regularly get up and walk while sitting and perform exercises to stretch the spine. Sports activities can also be the cause of overloading the spine. Sports such as tennis, golf, and weightlifting can lead to an overload of the spine if not performed correctly. It is important to use the correct technique during these activities and to carry out exercises to strengthen the spine. Various methods are used to treat spinal overload, including physiotherapy, anti-inflammatory drugs, and injections. In some cases, surgery may be required as conservative treatment and improvement of the patient's condition. Hereditary factors. A herniated disc is a condition in which the intervertebral disc bulges in the spine, which can cause pressure on the nerve roots and cause pain, numbness, or weakness in the arms and legs. Have more hereditary factors, which can increase the development of hernia discussions. The first hereditary factor is genetics. Studies have shown that some people are more prone to developing disc herniation due to genetic factors. Some genes may have the structure and power of interlayer plates, which may increase their protrusion. Another factor is age. With age, the intervertebral discs gradually dry out and become less elastic, which can increase their damage and protrusion. Just like that, you can have the body's ability to restore the age structure of the intervertebral discs, which can show the symptoms of the discussion. Some life factors can thus contribute to the discussion about its origin. For starters, excess body weight can increase the load on the spine and increase damage to the intervertebral discs. So can lifting heavy loads, but repetitive movements, such as in sports which require arching of the back, increasing the risk of disc herniation. In addition, it can be held but irregular loading of the spine, which is a consequence of incorrect sitting or inadequate workplaces, contributing to the emergence of the discussion. Such postures can cause excessive strain on certain parts of the spine and increase the magnification for damage to the intervertebral discs. In conclusion, a herniated disc can affect dogs, but some people are more prone to develop it due to hereditary factors such as genetics, age, being overweight, lifting heavy loads, and poor posture. Understanding the factors in accepting measures to reduce them can help prevent herniated discs or improve treatment. Age and natural aging processes. The spine, as part of the human skeleton, supports the body, enables movement, and protects the spinal cord. However, over time the spine begins to change and lose its strength and flexibility. This is a natural aging process that can be caused by a number of factors, including genetics, lifestyle, and injury. As we age, the intervertebral discs, located between the vertebrae, lose water and elasticity. This can lead to a reduction in the space between the vertebrae and the formation of osteophytes, which are bony growths on the edges of the vertebrae. It can also happen that the nucleus of the disc moves outward and puts pressure on the spinal nerves, causing pain and other problems. Besides, degeneration of bones and joints can also contribute to spinal problems. Bones become less dense, which can lead to vertebral fractures or bone loss that can end up as osteoporosis. The joints become less flexible, which can lead to limited movement and pain in the spine. However, there are steps we can take to maintain a healthy queen and slow her aging. It is important to maintain a healthy weight, exercise regularly, drink enough water and get enough sleep. Exercises such as yoga, Pilates and swimming can be particularly useful for strengthening muscles and maintaining spinal flexibility. Using proper lifting technique is also important to avoid injury to the pelvis. If you already have problems with your spine, physiotherapy or acupuncture can help reduce pain and improve flexibility. In short, although the aging of the spine may be inevitable, there are steps we can take to reduce the risk of spine problems. It is important to maintain a healthy lifestyle, exercise regularly, and use proper lifting techniques to maintain a healthy queen as long as possible. Traumas and injuries to the spine. The spine is one of the most important parts of the human body. Trauma or injury to the spine can have serious consequences for an individual's health and quality of life. There are many different causes of spinal trauma and injury, including accidents, falls, sports injuries, degenerative changes, infections, and tumors. Injuries to the queen can be divided into two types: mechanical injuries and neurological injuries. Mechanical injuries are caused by a direct impact on the spine, such as a fall, impact, or sudden movement of the body. Neurological injuries occur when the spine affects the nerves that pass through it. It can be caused by compression of the nerves or their interruption. The most common mechanical injury to the spine is a fracture. A spinal fracture can be very serious and can lead to permanent consequences, such as paralysis or reduced mobility. In some cases, surgery is necessary to treat spinal fractures. Neurological injuries to the spine can be caused by spinal stenosis, disc herniation, or tumor growth. These injuries can affect the ability to move, sensory function, and the function of internal organs. There are several risk factors for pelvic injuries, including age, gender, obesity, inactivity, genetic factors, and poor posture. It is important to handle objects properly, avoid sudden movements, and follow safety instructions for sports activities. Treatment of spinal injuries depends on the type and severity of the injuries. In some cases, conservative treatment methods, such as physical therapy, can be effective. In other cases, surgery may be necessary. It is important to seek professional medical help in case of trauma or injury to the spine, so that they can be diagnosed and treated in a timely manner. In conclusion, trauma and injuries to the queen can be very serious and affect the quality of life of the individual. Chapter 3: Symptoms of a herniated disc. Back and slash or neck pain. Back and slash or neck pain is a common problem faced by people of all ages. This type of pain can be caused by many factors, including poor posture, excessive sitting, excessive muscle strain, stress, or injury. When it comes to neck pain, the most common cause is tense muscles in the neck or shoulders. This problem can be caused by bad posture, sitting at the computer for a long time, sleeping in an uncomfortable position, or some other activities that stress the neck muscles. Neck pain can also occur as a result of a neck injury such as whiplash, falls, or blows. Back pain can be caused by a number of factors, including sitting in an uncomfortable position, excessive muscle strain, excessive physical activity, as well as spinal disorders. Sometimes back pain can occur as a result of stress, poor posture, or weight gain. When faced with back and slash or neck pain, the best solution is to seek professional advice. Physical therapy, massages, stretching exercises, or yoga can help reduce pain and improve the general condition of the body. In addition, proper posture, using ergonomic chairs and tables, and avoiding excessive physical activity can also help prevent back and neck pain. It is important to remember that back and slash or neck pain can be a symptom of a more serious health problem, so it is advisable to seek medical help if the pain becomes chronic or occurs in combination with other symptoms such as fever, numbness, or loss of sensation. Timely diagnosis and treatment can prevent complications and improve quality of life. Pain in the arm, leg, or foot. Pain in the arm, leg, or foot can be caused by many factors, including injury, overuse, infection, disease, and conditions such as arthritis or diabetes. When it comes to arm pain, the most common cause is injuries, such as strains, sprains, or fractures. This problem can be caused by excessive use of the hands or incorrect body position when performing daily activities. Hand pain can also be caused by conditions such as tendinitis, arthritis, or carpal tunnel syndrome. Leg pain is often associated with muscle or bone injuries such as fractures, muscle strains, or sprains. This problem can be caused by excessive activity, incorrect body position, or poor blood circulation. Leg pain can also be caused by conditions such as varicose veins, neuropathy, or heart disease. Foot pain can be caused by injuries, such as sprained ligaments, fractures, or sprains. This problem can also be caused by conditions such as plantar fasciitis, arthritis, or conditions such as diabetes. Excess body weight, bad shoes, or incorrect body position can also contribute to foot pain. When you are faced with pain in your arm, leg, or foot, the best solution is to seek professional advice. Physical therapy, stretching exercises, or yoga can help reduce pain and improve the general condition of the body. In addition, proper posture, using adequate footwear, and avoiding excessive physical activity can also help prevent pain in the arm, leg, or foot. It is important to remember that pain in the arm, leg, or foot can be a symptom of a more serious health problem, so it is advisable to seek medical help if the pain becomes chronic or occurs in combination with other symptoms such as fever, swelling, or loss of sensation. Timely diagnosis and treatment can prevent complications and improve the quality of life. Tingling and slash or numbness in the extremities. Tingling and slash or numbness in the extremities can be caused by various factors. Common causes include problems with the nervous system, circulatory system, and musculoskeletal system. In the case of problems with the nervous system, tingling and slash or numbness can be the result of nerve damage, which can be caused by injuries, infections, toxins, or other diseases. Nerve damage can cause problems with sensation, mobility, and function in the extremities. Problems with the circulatory system can also cause tingling and slash or numbness in the extremities. Poor blood circulation can lead to insufficient supply of tissues with oxygen and nutrients, which can cause numbness and weakness in the extremities. In the case of musculoskeletal problems, tingling and slash or numbness may be caused by pressure on nerves near the joints or spine. This often occurs in people who spend long periods of time sitting or standing, and in those who have poor posture. Treatment for tingling and slash or numbness in the extremities depends on the cause of the problem. If the cause of the problem is an injury, infection, or other disease, treatment is needed to eliminate the cause of the problem. If the cause of the problem is poor blood circulation, lifestyle changes are recommended, such as exercise, quitting smoking, and eating healthy foods. If the cause of the problem is pressure on the nerves, a change in body position and exercises to strengthen the muscles are recommended. Anyway, if tingling and slash or numbness in the extremities occurs frequently or is accompanied by other symptoms, it is necessary to consult a doctor in order to determine the cause of the problem and recommend appropriate treatment. Muscle weakness. Muscle weakness is a condition that can occur for various reasons and usually manifests as a loss of strength and a decrease in muscle functionality. It can be limited to a specific muscle group, or it can occur throughout the body. The most common cause of muscle weakness is lack of physical activity. When we don't use our muscles enough, they become weaker and less functional. This can happen for a variety of reasons, such as prolonged periods of lying down, sitting in front of a computer, or lack of regular physical activity. However, muscle weakness can also be a symptom of a more serious health problem. For example, neuromuscular diseases, such as myasthenia gravis or multiple sclerosis, can lead to muscle weakness. Also, damage to the nerves that control muscles or some systemic diseases such as diabetes or arthritis can affect muscle function and lead to weakness. Symptoms of muscle weakness can vary depending on the cause. Caused by a lack of physical activity, the weakness can be mild and manifest only with exertion. With other causes, the weakness may be severe and prevent normal daily activities. Treatment for muscle weakness also depends on the cause. In cases caused by a lack of physical activity, exercise and physical therapy are recommended to strengthen the muscles. In other cases, it may be necessary to treat an underlying health problem with the prescription of drugs or other therapeutic methods. If you notice muscle weakness, it is important to see your doctor. He can help determine the cause and recommend appropriate treatment to improve muscle function and prevent further deterioration. Chapter 4: Diagnosing a herniated disc. Physical exam. Diagnosing a herniated disc, which refers to a condition in which part of the disc between the vertebrae moves and presses on the nerves in the back, usually begins with a physical exam. During this examination, the doctor will ask the patient to perform certain movements and body positions in order to assess whether there are any neurological symptoms or other abnormalities that point to a herniated disc. Magnetic resonance MR. After a physical examination, a doctor will usually order a magnetic resonance MR scan as a diagnostic procedure that uses a magnetic field and radio waves to create a detailed picture of the inside of the body. MRI is very useful for diagnosing a herniated disc because it can show exactly where the disc has moved and how much pressure it is putting on the nerves in the back. Computed tomography court. Computed tomography court is another diagnostic procedure that can be used to diagnose a herniated disc. A CORT scan uses X-rays to create a detailed picture of the inside of the body and is often used in conjunction with an MRI to get a more complete picture of the problem. Electromyography imaging. Electromyography imaging is a test used to measure the electrical activity of muscles and nerves in the back. This test can help diagnose a herniated disc because it shows how electrical signals travel through the nerves and muscles in the back. Discography. Discography is an invasive diagnostic procedure used to determine the exact location of a herniated disc. During a discography, a contrast agent is injected into the disc between the vertebrae, and then an X-ray is used to determine the exact location of the disc and how much pressure it is putting on the nerves in the back. In addition to the above diagnostic procedures, the doctor will usually review the patient's medical history and consider the symptoms the patient is experiencing. All this information helps in determining the diagnosis of disc herniation and proper treatment of the patient. Chapter 5: Treatments for herniated discs. A herniated disc occurs when the inner part of the intervertebral disc, which normally serves as a shock absorber between the vertebrae, breaks out of its normal position. This can put pressure on the nerves in the back and cause pain, numbness, and weakness in the legs. Fortunately, there are treatments that can help relieve symptoms and improve the quality of life for people with a herniated disc. Conservative treatments. Diagnostics. Physical therapy. One of the treatments used to treat a herniated disc is conservative therapy, which consists of rest, ice, and heat, physical therapy, and pain relievers. This therapy usually lasts from a few weeks to a few months and can be very effective in reducing pain and increasing the mobility of the spine. Surgical treatments. Discectomy, spinal fusion. In some cases, when symptoms do not improve after conservative therapy, surgical intervention may be required. Surgery is usually performed if there is severe pressure on the nerves or if conservative therapy does not produce results after several months. There are several surgical procedures used to treat herniated discs, the most common being discectomy and microdiscectomy. A discectomy is a procedure that removes the entire disc that is causing pressure on the nerves. A microdiscectomy is a similar procedure, but involves a smaller incision and uses microscopic technology to remove only the part of the disc that is causing the pressure. Alternative treatments: chiropractic, acupuncture, massage. It is important to note that there are also alternative treatments for disc herniation, including chiropractic, acupuncture, massage, chiropractic, and other forms of integrative medicine. However, before using any alternative treatment, it is important to check with your doctor to make sure they are safe and effective for your condition. In conclusion, treatments for herniated discs depend on the severity of the symptoms and the individual needs of the patient. Conservative therapy is usually the first step in treatment, but if it doesn't work, surgery may be necessary. It is important to consult with your doctor to find the best treatment for your herniated disc and to improve your quality of life. Chapter 6: Preventing herniated discs. Maintaining a healthy lifestyle, exercise, healthy diet. Maintaining a healthy lifestyle is key to maintaining optimal health and preventing many diseases. This includes not only exercise and a healthy diet, but also enough sleep, maintaining mental health, and avoiding bad habits, such as smoking or excessive alcohol consumption. One of the most important items in maintaining a healthy lifestyle is a healthy diet. This means eating a balanced and varied diet that includes fresh fruits and vegetables, whole grains, legumes, nuts and seeds, lean meat and fish, and healthy sources of fat such as avocados, olive oil, and nuts. It is necessary to avoid fast food, sweets, and processed food that contains a lot of sugar and saturated fat. Regular exercise also plays a key role in maintaining a healthy lifestyle. Physical activity not only helps maintain a healthy body, but also improves mood and reduces stress. At least 30 minutes of moderate physical activity 5 times a week is recommended, which can include walking, running, swimming, cycling, or any other form of physical activity that appeals to you. Getting enough sleep is also important for maintaining a healthy lifestyle. 7 to 9 hours of sleep each night is recommended for adults. Lack of sleep can lead to problems with concentration, mood, and productivity, and increase the risk of heart disease, diabetes, and other health problems. Mental health is also an important aspect of a healthy lifestyle. It is important to find ways to reduce stress and anxiety, such as meditation, yoga, deep breathing, or other relaxation techniques. Talking to friends and family can also be helpful for maintaining mental health. Finally, it is important to avoid bad habits such as smoking and excessive alcohol consumption. Lifting correctly and avoiding overloading the spine. Lifting correctly is key to maintaining a healthy spine and avoiding overloading the back muscles. Many people think that lifting weights is a simple task, but in fact there are certain rules that must be followed to avoid damage to the spine. First of all, it is important that the load is lifted correctly. One should place himself in a flat position, and then kneel next to the load. The body should be in a slight straight line, and the spine should be in a natural position. You need to bend at the knees and hips so that the load can be taken. The load should be firmly held, not hanging freely. When lifting a load, it is important that it is held firmly and that the load does not rotate or move suddenly. The body should be in a straight line, not bent. It is important not to raise the load too high, as this can cause strain on the muscles of the back and spine. If the load is heavy or too large, you should always seek the help of other people or use mechanical devices to lift the load. This will reduce the risk of injury and overloading the spine. Along with lifting properly, it's important to maintain healthy habits. Regular physical activity, especially yoga and stretching, can help strengthen back muscles and reduce the risk of spinal injuries. Also, it is important to maintain proper body position during the day, especially sitting at a desk or standing for long periods of time. Finally, if you experience back pain or other symptoms, you should seek medical advice immediately. Early diagnosis and treatment can prevent further damage to the spine and relieve pain. In short, proper lifting is key to maintaining a healthy spine and avoiding overexertion of the back muscles. It is important to follow certain rules, use mechanical devices if the load is too heavy, maintain healthy habits, and seek medical advice if symptoms appear. Regular examinations of the spine. The spine is one of the most important parts of the body, which plays a key role in the stability and mobility of the body. However, like any other part of the body, the spine can be susceptible to injuries and diseases that can lead to serious health problems. Regular spine examinations are important for maintaining health and preventing injuries or diseases that could affect it. In addition, regular checkups can also help in early detection of any problems or abnormalities of the spine. It is common for people to consult a doctor when they already feel back pain or discomfort, but often it is too late. Many spine problems develop gradually and may be asymptomatic in the early stages. Therefore, regular spine examinations can help detect and treat problems before they become serious. Regular spine examinations usually include an examination by an orthopedist, neurologist, or physiatrist. During the examination, the doctor will assess the condition of the spine, look for signs of injury or disease, and recommend the necessary therapies or exercises to improve the health of the spine. In addition to regular checkups, there are several things you can do to maintain a healthy spine. Maintaining a healthy lifestyle, including regular physical activity and a healthy diet, can help maintain spine health. It is also important to avoid excessive strain on the spine, especially if you are prone to injury or pain. In conclusion, regular spine checkups are key to maintaining health and preventing serious problems. In addition, adopting healthy habits and avoiding excessive strain on the spine can help maintain spine health and reduce the risk of injury or disease. Therefore, if you haven't already done so, consider seeing your doctor for a regular spine checkup to keep your body in the best possible health. Conclusion: disc herniation is a common disease of the spine that can cause serious symptoms and disturbances in everyday life. However, there are many treatments that can help relieve the symptoms and cure a herniated disc.